Jared mentioned, my name is Bill Nordmark. I'm president and CEO of Aver. As he mentioned, our mission is to help the industry design, develop, implement, and administer value-based contracts. Our initial start is in the episode space, but we're moving beyond that into many other types of value-based contracts, which I'll talk a little bit more about here in just a few seconds. A little bit at a glance of Aver and our history. We started in 2010. A little bit after our start, we launched our partnership with Amazon, AWS. Company moved to Columbus and signed the first partnership with a company called HCI3 at the time, or Alterum. Now, we have the ability to do all 97 Prometheus episodes on our platform. In addition to our platform is the only engine that can completely customize episodes from scratch. So if you wanted to build your own episode methodology, you could use our tool to do that as well. On top of that analytics engine, we launched a Tableau interface, a pricing engine, and reconciliation technology in 2017. We rolled out a new tech-enabled service in 2018, and they're now in 2019 going live with the first ever in-market end-to-end value-based tech-enabled service, which we'll talk a little bit more about in a few minutes. Our customer base includes 14 of the top industry-leading health plans. Majority of them are Blues plans and regional commercial payers. What is interesting about our tool set is our health plans cover many different types of benefit types. So we're doing Medicaid, we have Medicare plans around Medicare Advantage, we have normal commercial plans, and a large part of our book of business is also ASO business or self-funded targets. We also have 3 leading hospital organizations that use our tools. They use our tools to actually do direct contracting with employers. And also manage ACO populations using our analytics engine. So from our perspective, we're very unique in seeing bundles across different episodes across a different type of set of organizations. So the market is shifting rapidly towards the move to episode and value-based programs. This is a short view from different types of industry organizations. Some in media and press and consulting that are talking about the expansion. Obviously, we know that CMS has come back with the BPCI program, BPCI Advanced, and mandating some of those programs. And then also key payers are moving more and more of their programs to value-based incentives. And as much as that is happening, and I'll make sure the Amazon team has access to this paper, McKinsey came out with a white paper around how episode-based reimbursement could be upwards of 50 to 75% of all payer-to-provider reimbursement could fall into episodes. And 2 main things that they mentioned in this paper, which are very interesting, is going beyond a reimbursement type. You can look at population health management through episode methodology. And from a consumer perspective, the one thing that we love about episodes is there's 100% price transparency in an episode. So the consumer knows exactly what they will pay at the time of service in prospective episodes, and I'll talk about some prospective episodes that we have in place today. So for the payers in the room and some of the providers, what are the challenges that health plans have in implementing value-based programs? Well, the number one challenge is the complexity around contracting these networks. The majority of health plans are used to contracting an HMO, PPO, indemnity plan design, and you take the same contract to every provider and you say, do you want to participate? In a bundle or episode or in any other value-based mode, it is a negotiation. You are sitting down and talking about what's in, what's out. You're talking about how you can meet a target price and what the upside downside risk is. And so that complexity forces a big investment into the network contracting space. The number 2 item, and the gentleman from Apixia mentioned it earlier, if you've seen one health plan, you've seen one. the challenges of those claim systems that are all different. Doesn't matter if you're on Facets or Amisys or anything else. It's whatever your version is that you've created. None of them are prepared to do value-based contracting. So if you look at the investments health plans have to make in order to support these programs, there is a significant admin cost that goes into that. So what is the challenge with that? Well, all the health plans under the ACA are held to the 85-15 medical loss ratio, and this is where regulation doesn't meet reality. And so if I'm going to invest in these programs and my admin cost is going to go up, and I'm ultra successful, I'm decreasing medical spend, then those two are not congruent. So as you can see here on the graph on the right, there is this outward movement of when these value-based programs will happen. And based on what we do and Amazon being our back end, we've come up with a model that we help health plans basically design, develop, and administer contracts with 4 main services. So we do all the analytics to design the value-based programs, what methodology they want to use, what episodes they should target, what providers should be in those programs. We also define what price those providers should be using, what upside downside risk should be in that from an analytics perspective. We then help them actually contract the network. So we have a network team that will sit down and negotiate and help the health plan and provider negotiate what's in, what's out. We have the first admin, think about it as a ride-along claims platform that basically allows for adjudication of any value-based program, whether it be bundles, whether it be global capitation, that sits in line payer workflow and works with their current workflow. So they don't have to change anything. Fee-for-service comes in. We handle all the value-based reimbursement. And then we are in the process of working on building a network that payers can rent that is already kind of ready-made for them in markets where they can access providers. So as you can imagine, our evolution of our company going from when we started as just an analytics engine, moving all the way into a full tech-enabled service has been a very, very interesting road. And one, quite frankly, that we've taken in partnership with Amazon. So this is just a high-level view of current, Amazon technology that we use today, our current platform. And one of the interesting things for us has been moving along that path from just a giant analytics company and analyzing enormous amounts of data. We now moving into what we call our bundle benefit management solution, which is the transaction platform, have to marry together a large analytics analysis environment with a full real-time transaction processing in batch mode that's going to connect with payers. It's been an interesting ride, and our teams have been using a significant amount of Amazon capabilities, AWS capabilities, which we've been extremely excited about. So we have a very robust environment that our team uses. And one of the things that we have been ultra excited about, at least in our space, is that we are the only vendor in our market that's HITRUST certified. And so for those of you in the market that maybe are HITRUST certified or not HITRUST certified, you can imagine that the work to become certified in the healthcare space is not trivial for a young private equity-backed company. And our partnership with Amazon, and AWS made it significantly valuable for us. So we are in our interim assessment now. We go through our recertification next year. But the partnership with AWS and our controls has basically made us the leader in the space from the standpoint of, if you're any vendors out there that work in the healthcare space, you get the security questionnaire from most of the health plans. And basically, we only have to do 25% of it because HITRUST takes care of everything else. And we've been very excited about this with our partnership with AWS. So the results. I have 2 case studies here that we're very excited about, 2 different health plans. The customer A on the left over here shows you the value of the episode programs that are in working. So going back to 2016, when we first launched this episode program with these health plans, basically we have been able to change the savings versus the trend roughly about 15%. This is medical spend. So the average episode price in 2018 per episode, these are knees, total knees, has gone down by $3,700 for this health plan. These are retrospective programs. And so you can see that we're bending the cost curve from a medical spend perspective. Customer B is a very interesting opportunity for a major Blues plan, where on 320 cases, so think about this, only 320 cases of prospective hip replacements and total knee replacements, we were able to save them $4 million of cost. That $4 million of medical spend came in two different areas. Readmission rates were down significantly as quality was up, and the thought of potentially avoidable complications or complications during surgery was down about 43%. So in a prospective bundle, when you're putting the initiative in the hands of the physician to basically manage the cost and quality, and they have targets to meet, you can see the success of basically only 320 cases equating to $4 million of cost reduction. The other beauty of these bundles is there's 100% price transparency. So the patient walking into these 320 cases knew exactly what the cost was. They were not on the hook for anything more than that cost. And had there been basically more than the amount spent, the providers are eating that cost. So how do you get there in these programs, and how does our platform support? Well, this is kind of a case study on one of the things we're doing. You get to a target price for a knee of $26,500, let's just say, and then the downstream costs that go along with it are how you hit that target price. The interesting thing about this when we started was that about 60% of the cost is actually the physician themselves. Those are complications and readmission rates. About 40% of the cost is downstream utilization, obviously the use of PT, anesthesia, pharmacy, labs, but also the difference in sending folks to skilled nursing facilities or rehab and the reduction of those. So the interesting thing is this provider has a Marriott Autograph Hotel across the street from their surgical center. And lumped into the price is a one-night stay at the Marriott Autograph Hotel for the patient and family to go to within 23 hours of surgery, so there's no 24-hour stay. So as you can see, our platform is running all the technology, is running all of the value behind this to make it work for the health plans and the providers. The outcome is a total transformation of how care is delivered. And a better outcome for the patients. So why Aver and why do we continue our partnership with AWS? We were looking from day one, as mentioned, the company started in 2010. Immediately we did our partnership with AWS. We were looking for one platform that we could build on. We were looking for a partner that could enable our future growth. And since then, as I mentioned, we have specifically grown with the capabilities with that Amazon provided. We needed to scale our products across different capabilities. So we knew that we would go from a giant analytics business to a transaction processing business, and that our architecture needed tools and capabilities that would enable that. We also needed the ability to scale up and down for use of capital. We're a young private equity-backed company. The maximization and capital efficiency is critical. And we, as I mentioned, moving into the transaction space, we've been able to roughly cut our Amazon cost by 50% on a monthly basis by using the new capability to scale the infrastructure. What does that enable us to do? That enables us to use those dollars to grow the company in other areas. And as evidence, I was talking to some of the team last night, one of our largest Blue Cross Blue Shield plans next week will send us 2 years of claims history on 29 million covered lives to run through our analytics engine and do an opportunity analysis on where they can target with episodes. Currently, we're doing hips and knees for them. We're building oncology, and we want to expand into substance abuse, maternity, cardiac, and spine. So you can imagine we don't necessarily need an infrastructure that supports 29 million members over 2 years all the time. And we've been able to scale up and down very well with the new capabilities. And also, as I mentioned, the high trust capability that AWS provided, for us was a main item.